Good afternoon, y'all. Nice to see you. Hopefully this recording is going to work today. I am so sorry for the delay in getting this content to you, this lecture. I've recorded it about 15 times now and had tons of technical difficulties, obviously, since you haven't gotten it yet. Not really sure what's going on there, but either way, no excuses. I'm very sorry that it's been delayed in getting it to you. So hopefully it works this time without any trouble. So today we are going to talk about cancer, and so we will get that started. So chapter 21 discusses cancer development. That begins on page 359. Some stats. According to the American Cancer Society, half of all men and 1/3 of all women will develop cancer. Cancer will occur in about 1 in 3 people. So what is our role as RNs? Our role is really going to be focused on prevention, teaching of early detection, and screening. Secondary, so yes, Ms. Candler is very proud that y'all remember that. So true or false? Some cells continue to grow and divide in the body, and this is normal. That's true, excuse me. Growth of cells and tissues is normal, and many body cells continue to grow by mitosis long after maturation is complete. Cells of the skin, hair, mucous membranes, and bone marrow have the ability to divide. Again, that is true. Growth is regulated through cellular regulation. Growth of these cells is controlled, so only the right number is present. Again, this is true. And other tissues stop growing and dividing, and this is normal. This is true. For example, cardiac muscle cells. So an example of this, some cells do stop growing in numbers and dividing, such as the heart muscle. The actual size of the cell may enlarge, but there is not an actual increase in the number of cells. So this comes into play concerning hyperplasia and hypertrophy. So hyperplasia is going to be an increase in size by increasing the number of cells, whereas hypertrophy is going to be an increase in size by enlarging each cell. So any cell growth beyond what is normal or needed is called a neoplasia. This is always abnormal, even if it does not cause harm. So were cancer cells once normal? Yes, they were once normal, but they underwent genetic mutations. So here's some information on characteristics of cells. Y'all, I don't expect you to memorize these, so don't get excited about this slide. Just want you to know just for general purposes. So normal cells have limited cell division. They do undergo apoptosis. Each cell has a distinct and recognizable appearance, size, and shape. They have a small nuclear to cytoplasmic ratio. Each cell has at least one special function, and they do adhere tightly together. They do not wander from one tissue into the next. Normal cells grow in an orderly and well-regulated manner. They are contact inhibited. Each cell only divides when its surface is not in direct contact with another cell. Once a normal cell is in direct contact on all sides, mitosis stops. And normal human cells have 23 pairs of chromosomes. Now with cancer cells, they have rapid or continuous cell division. They do not respond to signals for apoptosis. They have an unlimited lifespan. They do have a loss of specific appearance. The nucleus of a cancer cell is larger than that of a normal cell. They serve no useful purpose. They adhere poorly to each other and break loose. Because cancer cells are loosely bound, they are able to spread or metastasize. They do invade other tissues and continue to divide when they are touched on all sides, and they can have more or less than 23 pairs of chromosomes. So what are some other names for cancer development? Carcinogenesis and oncogenesis are some other names for cancer development. A normal cell becoming a cancer cell is called malignant transformation. So how many cells have to undergo malignant transformation for cancer to begin? Interestingly, it only takes one cancer cell. If growth conditions are right, widespread metastatic disease can develop from just one cell. So for initiation, for cancer development, there is a process that occurs with the cells, and that's what this initiation is. It's the first step of the process. So it is an irreversible event that can lead to cancer development. A cell can become a cancer cell now if cell division isn't stopped. Substances that change the activity of a cell's genes so that the cell becomes a cancer cell are carcinogens. Carcinogens can be chemicals, physical agents, or viruses. If the environment is right, only one cancer cell can cause cancer. So the next step in this process is going to be promotion, and that is the growth of a cancer cell. So once a normal cell has been stimulated by a carcinogen and is a cancer cell, it can become a tumor. So what is the latency period and how is it shortened? Your textbook talks about this on page 362 under the section titled Promotion. That whole paragraph talks about it, but generally speaking, the latency period is going to be the time between a cell's initiation and the development of an overt tumor. It can last anywhere from months to years, and exposure to promoters can actually shorten this latency period. So the next step in this process is going to be progression. That is the continued change of a cancer, making it more malignant. A tumor is formed. The tumor must develop its own blood supply to get nourishment and thrive. Subpopulations develop, and these cell groups may have advantages that allow them to live and divide no matter how the conditions around them change. And then the tumor becomes more malignant. And then you have the final stage, which is metastasis, where cancer cells move from the primary location by breaking off. So with cancer, the original tumor is going to be identified as the primary tumor. Any additional tumors occurring from metastasis are going to be called metastatic or secondary tumors. Spread to distant organs and tissues occurs through blood-borne metastasis. Guys, this is important for you to remember. Blood-borne metastasis is the most common cause of cancer spread. So remember, again, just because a tumor has metastasized and is in a new location, it still broke off of the original location. So for example, if breast cancer spreads to the lung and bone, it is still going to be classified as breast cancer. It's not going to be changed to lung cancer or bone cancer. It's just breast cancer that's metastasized. So here's some matching for y'all. I'm sure you know these off the top of your head, but you do have the answers on page 364 in your textbook. So hemangio stands for blood vessel. Rhabdo is going to be skeletal muscle. Melano is pigment producing skin. Chondro is cartilage. And lipo is fat. So now we're going to talk about cancer grading. This is on page 365, table 21-4. Again, I don't expect you to memorize this. I just think it's important that you have a general idea. So what does cancer grading do? It compares the cancer cell against the normal tissue that it arose from. So with GX, it cannot be determined. G1 closely resembles normal cells. G2 retains some of the characteristics of normal cells. G3 is poorly differentiated, but the origin can usually be established. And G4 retains no normal cell characteristics. Tissue of origin is difficult to determine and may be impossible. So what does cancer staging do? Cancer staging is used to determine the exact location of the cancer and its degree of metastasis. It is used with a TNM system. That stands for tumor, node, and metastasis. So why is staging important? Staging actually helps to standardize cancer diagnosis, prognosis, and treatment. And so what are the different types of staging? This is important for you to know. This slide says you may see this on your exam. I would just suggest that you know it. So T for tumor. If it's T of X, that's going to be primary tumor that can't be assessed. T0 is going to be no evidence of primary tumor. TIS is for carcinoma in situ. And T's 1 through 4 mean that the tumor is sizable. For N or nodes, NX means lymph nodes can't be assessed. N0 means there is no lymph node metastasis. And N1 through 3 means that there is increasing lymph node involvement. And then finally for metastasis, MX cannot be assessed. M0 means there is no distant metastasis, and M1 means there is distant metastasis. So just kind of a general easy way to remember this is going to be if it has an X next to it, it means it cannot be assessed. If it has a 0, it means there is no evidence. And if it has 1 through 4, then that means that there is going to be some involvement. So, for example, a patient is T2N1M1. That means that the patient has a tumor that is sizable with lymph node involvement and distant metastasis. So, 3 factors influencing cancer development are going to be exposure to carcinogens, genetic predisposition, and immune function. These factors account for variation in cancer development from one person to another, even when each person is exposed to the same hazards. So basically what that's saying is 2 people exposed to the same hazards don't necessarily, it doesn't necessarily mean that they're both going to get cancer. One of them may get cancer, one of them may not. You have to consider these other factors. So some factors that cause or contribute to cancer are going to include alcohol, tobacco, arsenic, hair dyes, formaldehyde, sunlight, Epstein-Barr virus, human papillomavirus, radiation, low fiber intake, high intake of red meat, high animal fat intake, and nitrates. Interestingly, your text talks a little bit about this. So tobacco and alcohol appear mildly carcinogenic when they are looked at independently. However, when they are taken together, they enhance each other's carcinogenic activity, so they act as co-carcinogens. External factors are responsible for about 80% of cancer in North America. So some personal factors that can affect cancer development are going to be the immune system. For example, cancer occurs in patients older than 60 at a higher rate, and these are the patients whose immune system does not function as well. Advancing age is a very important risk factor, and then again, you're going to consider genetics. Okay, so cancer's early warning signs. This is important, again, to know. So I do want to tell you that there has been a change from this image, and it's listed in your textbook on page 367 in a little box, I believe. So the A in caution has changed, so just make sure you pay attention to that. So cancer's early warning signs are going to include the C, which is a change in bowel or bladder habits. A, on the chart here, it says a lesion that does not heal. According to your text, and what I want you guys to know is going to be A stands for a sore throat that does not heal. So what you need to know is that A stands for a sore throat that does not heal. U is going to be for unusual bleeding or discharge. T is thickening or lump in breast or elsewhere. I is indigestion or difficulty swallowing. O is obvious changes in a wart or mole. N is nagging cough or persistent hoarseness. So what can we do to prevent this cancer development? Do you remember the difference in primary and secondary prevention? I'm sure y'all do remember. Avoid factors that we know contribute to cancer development. Removal of at-risk tissue such as moles, colon polyps, and even breasts. Chemo prevention, which disrupts steps important to cancer development, and that can be done through drugs, chemicals, natural nutrients, and other substances. And then vaccination, that's talking about things like the Gardasil vaccination for that. So again, primary prevention is going to attempt to prevent cancer occurrence altogether, whereas secondary is going to be screening. So screenings, mammograms, clinical breast exam, self-breast exam, colonoscopy, prostate-specific antigen, and digital rectal exam for men over 50. Gene therapy can also be used. People can be screened for genes that will increase their risk of developing cancer. The benefit is that patients can alter their lifestyle or even have that tissue potentially removed to decrease their risk. Some consequences of cancer. What does cancer do to our immune system? Tumor cells enter bone marrow and reduce the production of white blood cells, red blood cells, and platelets. This places the patient at risk for infection, anemia, and thrombocytopenia. Some GI problems that can occur are going to be tumors may obstruct or compress anywhere in the GI tract. They may infiltrate the liver, and the patient may develop anorexia. So that's going to be it on this chapter. Hopefully this recording worked and you guys didn't have any trouble. And I will get the second chapter done and posted for you as well. Thank y'all.